Here's a quick walkthrough of what's available on the DetectedX Learner platform. I'll first show you an overview of the type of content available, the body systems and regions these cover, the imaging modalities and scientific disciplines, and ultimately who this is all designed for. Then I'll show you a couple of real examples so you can see exactly what the learner experience looks like. At a high level, DetectedX delivers content in three main formats. Lectures from the world's top experts on the topics, including radiologists, physicists, and clinicians. Self-assessment modules, or SAMs, where the learner backs up their theoretical knowledge with a practical assessment where they can interact with the images, mark abnormalities, then review the cases and see their scores. And quizzes, which is yet another format of assessment that now focuses on different clinical cases with questions to answer a variety of modalities. And in addition to that, there is other functionality within the learner platform, such as the image viewer, which is like a repository of interesting pathology or normal cases, and polls, which allows your students to interact with the content live in class. The content on DetectedX spans multiple body regions and systems, where our most comprehensive area is in breast imaging, which includes 2D mammography, digital breast tomosynthesis (DBT), contrast-enhanced mammography (SEM), and ultrasound of the breast. Beyond that, we cover the chest at both beginner and advanced levels, plus abdomen, neuro, musculoskeletal or MSK, trauma, nuclear medicine, and interventional radiology. And we also have a full structured series on X-rays called the Radiography Masterclass, which is designed to systematically cover every body region with quizzes and assessments to go along with it, and this is particularly aimed at radiography, medical, physio, and nursing students. In terms of modalities, DetectedX covers mammography, 2D and tomography, which is our most comprehensive on the platform, plain X-rays of course, which is also quite comprehensive thanks to the Radiography Masterclass and Trauma series, and then there is ultrasound, CT, nuclear medicine, and MRI. We also go beyond modality-based teaching into key supportive disciplines like diagnostic reference levels, or DRLs, radiobiology, statistics, and AI in medical imaging. Now, the platform is designed primarily for radiologists and radiographers across multiple skill levels, from university students and radiology registrars, all the way through qualified radiologists who are looking to upskill. So instead of a one-size-fits-all library, you can clearly see what's appropriate for beginners, what's aimed at training, and what's built for advanced interpretation and decision-making. And with all of these SAMs and quizzes on the platform, learners view and interact with these images with the same tools and features as they would in their normal clinical environment. That means images are in full resolution, they're interactive, and learners don't just read content, they actively work through the cases. On top of all of that, DetectedX captures the user's detailed interactions and responses as they go through the SAMs and quizzes, so they can see exactly how they performed, what decisions they made, and where their learning gaps are. And that performance data can also be provided back to the teacher or supervisor for analysis. Now let me show you an example of each type of content so you can see what it actually looks like in practice. First, I'll show you a self-assessment module on the breast. This is one that has both 2D mammography and DBT. When you open it up, you immediately see the projections laid out in a nice grid format, where you have the current images on top and the priors on the bottom. On the left is the series of images which you can scroll through and drag in to magnify. By pressing the spacebar, I can cycle through the different images of the breast. I can also select a particular set of views with the drop-down menu here. Note that in this one I have a regular 2D mammogram on the left, and on the right I have a DBT, the 3D view of that same breast. These images are all in full resolution and load up near instantly, even with your phone mobile hotspot connection, which makes it very handy. I can scroll through the DBT images, and if on one or more of them I notice an abnormality, I can identify that with the marker tool. Then I can click on the next case. And once again, I can cycle through these images, I can zoom into them, I can pan around, and change the windowing to help me identify potential cancers. If, however, I think it's a normal case, then I just leave it blank and move on to the next one, or finalize the submission. When you submit, there's a certain number of questions that we ask the user in order to provide appropriate feedback for them. And this is all customizable, by the way. And once they've done that, then they're met with their results scorecard, where they can assess their sensitivity and specificity performance, and also be able to compare their performance with someone on their own level. Now, the great thing about SAMs are that you can go back and check your answers to see exactly where the lesion was. In this particular case, the first one was normal, as you can see here. However, the second case, there was an abnormality, and that's been highlighted by these red circles. This really gives the learner a deep level of context around what's going on in each case, allowing them to identify where exactly the abnormality was. Now, this was only a demo case, but you can imagine a self-assessment module can include anywhere from 10, 20, 30, or even up to 60 individual cases. Next, I'll show you a preview of the radiography masterclass, where for each of the 17 body regions, there is a structured 6-part framework that aims to take the student from a beginner to a qualified status. Where the first module is showcasing the anatomy of that region of interest in 3D, covering soft tissue structures and each bone and joint so that you're familiar with the context of what we're dealing with for that body region. The second module introduces the radiography for that region, that is what the standard and miscellaneous projections are, what a normal X-ray looks like, when you would take, exclude, or add each projection and the justification for it, covering any pediatric considerations, and then talking about where you would take them, in addition to the centering point for each view and what to include to acquire a diagnostic image. The third module talks about the common pathologies in that region, showing what abnormal looks like by taking you through the common pathologies you would expect to see in that region, where the abnormal pathology gets discussed conceptually and then drawn and identified on an X-ray. Then the fourth module is positioning, where the patient is positioned live for all of the different X-ray projections introduced in the second module, covering how they're done effectively, covering a lot of tips and tricks learned over the years, essentially a comprehensive look at what radiographers do on clinical placement or when they're qualified. Then in the fifth module is the critique, where the quality of some poorly taken radiographs are assessed to know how to correct the positioning and technique just by looking at the X-ray. And finally, in the sixth module, the quiz section, students will test themselves through a lot of questions ranging from MCQs to finding and identifying different pathologies covered with a self-assessment module to evaluating clinically urgent findings and what they need to do when they see something that needs attention. And finally, let me show you a quiz. This one is on CT brain trauma, showcasing the axial images alongside some questions for the learner to answer. You can scroll through the images very easily like this, and if there were sagittal or coronal slices available, those would also be easily viewable either by themselves or in a grid format. So once the learner has had a chance to look through the CT brain, they can attempt the questions on the right. And as soon as they submit, they can see their answers of what they got right and what they got wrong. And often there is an explanation provided for the answers, as you can see here. Submitting the quiz then takes them to the results scorecard, showing the percentage of answers that were correct and the ability to compare their results with someone on their own level. And depending on how they performed in that particular quiz, the AI algorithm in DetectedX recommends the next best module to do to improve upon the skills that need it the most. So that's the platform at a glance. Multiple content types, a broad coverage across multiple body systems and modalities, structured for different professional groups and skill levels, and an experience that mirrors clinical image interaction while giving you performance insights you can actually use.